Dey glad say una don begin dey ask questions, especially the female folk. Una don begin dey ask questions. The question when they ask me recently be say, doctor, wetin dey cause bloody vaginal discharge? Wetin dey cause bloody vaginal discharge? Sometimes you just sit down, your period never come, blood go come out. Yes, e dey happen. Sometimes na normal, sometimes na sickness, pathology. So wetin be the normal things wey fit cause? No, might not say na normal sha. Sometimes one of the normal things wey dey cause bloody vaginal discharge or vaginal bleeding include one, pregnancy. Sometimes some people dey pregnant, but as they dey pregnant, they go get wetin they call implantation bleeding. Blood go come out, then they will start dey fear say na miscarriage. Sometimes sef dem no go even know say they dey pregnant. So that one fit be implantation bleeding. No cause for alarm. When you see that kind of blood, the first thing wey you go do be say you go see doctor. The doctor go prescribe you make you do ultrasound scan to show whether any pathology dey there. If no pathology, e go give you time, make maybe 1 week to see when you go see your period. If your period not show, then maybe likely na implantation bleeding. This one fit cause blood, spotting. Then another one wey fit cause bloody vagina be they call am again, oral contraceptive pills. You dey take oral contraceptive pills, you fit get wetin they call breakthrough bleeding. Breakthrough bleeding na that blood when we say e go just come out spotting. This one na normal, sometimes it happen. Now to tell you say the hormone drugs dey work, spotting, na they call am. Then another one fit cause vaginal discharge, blood, maybe hormonal problems such as hyperthyroidism. This one no sickness. This one na sickness. People when say they get hyperthyroidism, they get spotting today, they get bloody vaginal discharge sometimes, not every time, because all metabolic activity don't increase. So because of this, they will get what they call vaginal bleeding, though not much. Then which other thing fit cause vaginal bleeding? This one has still sickness, ectopic pregnancy. Some people they get what they call ectopic pregnancy. They get pregnancy when be say supposed to implant for inside the womb. E not go implant for the womb, rather e go implant for what they call the fallopian tube. When this thing start one rupture or a rupture, you fit get vaginal discharge, vaginal bleeding. This one na sickness, in fact na emergency. Another thing wey fit cause vaginal bleeding be wetin? Cervical cancer. I know why I come last for this one. Many people they take this one for granted. They take this one for granted. In fact, if any woman gets after sex, she gets bleeding after sex, she dey bleed or she dey get spotting, this is cervical cancer until proven otherwise. Wetin dey cause cervical cancer? People when we say they exposed to human papilloma virus, they get different type of human papilloma virus. People when they're exposed to human papilloma virus, they are at risk of developing cervical cancer. In fact, if you get multiple sexual partners or your husband get multiple sexual partners, there's likelihood that you are exposed to human papilloma virus infection, which could eventually cause cervical cancer in future. So now this one make the advice women when we say that they sexually active, irrespective say you get one man or you get just one man or you get 10 men, make you they do what they call pap smear. You go screen yourself for cervical cancer every 2 years. You go do pap smear. Now, madam, when they watch me, you even know what they call pap smear. You don't ever screen yourself for cervical cancer, talk less of say you even do pap smear. Many of us not even know what this thing be. And cervical cancer now don't they increase because infidelity na food now it can't be for our environment. Our house everywhere now infidelity. Anywhere you go, if you just say DNA test, you will see so many secret go start the day open. So e good say women make una do wetin, the cervical pap smear, make una screen una sef for cervical cancer. You no know who dey risk. So every woman wey dey sexually active need to do wetin, pap smear. E good make we screen ourselves for cervical cancer, because if you screen yourself, you see say you get metastatic changes in your cervix. Once they start treatment, e get 100% cure rate. So we don see wetin and wetin dey cause cervical vaginal bleeding. Some of them na disease, some of them na sickness, some of them na normal, like pregnancy, implantation bleeding, hormonal changes, stress. All these ones na normal. But the ones wey be say e no be normal, such as what, hyperthyroidism, cervical cancer, these na wetin doctor need to check to rule out cervical cancer. Una well done. Una thank you for watching.